I don't know what's going on. So, welcome. No. Little glitch with our technology this afternoon, but welcome. My name is Jamie Page Stadler. I'm the Director of Career and Professional Development at UW Oshkosh, and I am excited today to host ThedaCare as our career trek. As you know, Career Treks is a UW system initiative. This is our third year, and excited to bring regional employers to all UW system current students and alumni. The Career Treks are supported by a UW system committee made up of career advisors throughout the state. So a special shout out to the committee for planning these events. This is ThedaCare today, and next week we will have UW Madison hosting. And they will have PPD. For the students on today, we will have a verification form, which will be set in the chat in a few seconds. And then just a reminder that all of our career treks are recorded. So if you would like to review this career trek and learn more about ThedaCare in the future, this will be available on the website. So with no further ado, I am going to switch it over to ThedaCare and kick it off with Diane.
Wonderful. Thank you so much, Jamie. And thank you for allowing us this opportunity today to meet with the students, because, we feel as though that at ThedaCare, we have, something very special in terms of our culture and our organization. So we're extremely excited to be able to share some information with your students about that today. So what I'll do is I'll go over just a little bit more about ThedaCare and share a few roles and positions that we have. And then what I'll do is I'm going to hand it over to my colleagues, and they're going to also share a little bit about, what they do, their departments, and, if a student would be interested in a position, like what that career path would look like. So they'll share just a little bit about each of their areas. So, just going back to what do we do at ThedaCare? So we are a healthcare organization. We have been in existence for more than a century. And our organization serves 235 patients annually, approximately, and we have about 7,000 healthcare professionals throughout our region. ThedaCare's region is mainly Northeast Wisconsin, but with our hospitals are located in Appleton, Neenah, Berlin, Wisconsin, Waupaca, Shawano, New London, and Wild Rose. And we also have 35 clinics within a 9-county area. The other thing to note about ThedaCare is that we're a nonprofit healthcare organization, and with a level 2 trauma center. We have comprehensive cancer treatment, we have stroke treatment, we have cardiac programs, orthopedics, and also a foundation that helps us serve our community. Just a little bit of trivia for you. I just wanted to share with you, ThedaCare actually had gotten started in 1903 from a lady by the name of Theda Clark Peters. And some of you might know she was the daughter of Kimberly Clark, and you may be familiar with Kimberly Clark. But unfortunately, because there was no hospital nearby when she gave birth, she ended up passing away. And in her legacy, she had designated some money to build that hospital. So in 1909 is when ThedaCare got started. And so here we are, how many years later, and we have this amazing organization that has grown to 7 hospitals, again, nine counties, 35 clinics, over 7,000 employees. So, a couple of things to note is that, I really am proud about what our culture is like here. And, what does that? Why is it special? And I just wanted to share with the students that we had launched a program called Life Inspired several years ago. And so what does that mean? How does that apply to the workforce? Well, how do we work through that on a day-to-day basis? And really what that means is that, by working together, we are striving every day to reinvent healthcare. So, that's kind of the top of mind of what we have when we are going through our work. And we have five promises of that life-inspired movement. And some of those promises are, the five promises are: we put patients and families first. We empower each person to live their unique best life. We're making healthcare more affordable. We're making healthcare easier. And then we care for each individual holistically. So, that's what is driving our culture today. So I just wanted to share that with the students, so that we are really trying to be on the forefront of that change movement within healthcare. The next things I just wanted to touch on is there are, everybody thinks, okay, what can I do, or how can I apply my major within a healthcare organization if I'm not a typical nurse or, doctor or physician assistant. There's other things that other majors that can be applied in other positions. And, just to share with you a few, we have medical records, we have social workers, we have chaplains, we have human resource specialists, we have sports medicine, medical equipment specialists, data analytics, IT people, dietary, we have communication, social media, marketing, project managers, all sorts of different roles that it can be applied to the healthcare area. So with that, what I'll do is I'm going to turn it over to Lisa Nebel, who is our VP of Post-Acute Services, and she'll also share with you a little bit about ThedaCare and what we have to offer here.
So good afternoon, everyone. Thanks, Diane. She does a great overview. Wow. So again, I'm Vice President of Post-Acute. What that means is I supervise everything outside of the hospital. So for example, I have the 2 nursing homes. We have one in Appleton and we have one in Berlin. What we have to offer there is positions from direct patient care to food service facilities. So also some non-clinical roles. I also oversee home care, hospice, palliative, and the DME stores are another area. As Diane said, think of us as, healthcare plus. We have sales jobs, we have marketing jobs, we have data analytics jobs. So there's a lot of opportunity, even if you're non-clinical. Again, we're post-acute, we'd really love some data people, some IT people. So again, think bigger. And I think what makes our organization different, what really drives our organization, is our values and principles. And I think we all care for our community, but we all think about compassion, whether it is a patient or a family or a customer. We are very a compassionate group of people. We are all leaders, and leadership is really important. So if you're looking to grow your career, we are a large organization, and certainly you would have opportunities for leadership. As Diane said, we're always, thinking about excellence. How do we innovate? How do we do things better? We also like to be agile, and we're really open to ideas. So if you are looking for, a place to be creative, we'd love some creative ideas. We'd love some innovative people. We're really looking to automate. So if you are, of that mindset, healthcare is also the place for you. So again, all of these leaders on the screen actually are directly in the work. So again, I'm just the operational leader of things outside of the hospital. So I'll pass it to Anessa. She is our Director of Hospice and Palliative Services.
Good afternoon. My name is Anessa, as Lisa had mentioned, and I oversee our hospice and our palliative care. So we have all kinds of disciplines that come to help. So we also take volunteers. So if you're interested in volunteering and kind of testing the water a little bit and seeing if this might be an area that you would be interested in, we would love to have you and come and check it out. There's a lot of opportunities that we have. We have aides, we have chaplains, social workers. We have a full disciplinary team. And really, without having all of the additional individuals coming together, we really can't make it happen without a full team. So it's really great to have our team. And as everybody else has already mentioned, there's a lot of support. So we have individuals that are in billing and help us with that, and payroll and HR and all kinds of great services that really help to support us as leaders in the work. So that is one of the things that we love to do. We are one of the few agencies that I've really heard that have really stuck to our longer orientation times for individuals. So I think a lot of facilities, you're hearing that they're pushing people through the orientation process because staffing is an issue and they need to get individuals through. But we've really stuck to our orientation time schedule. So we're not putting people out there without the appropriate preparation to do their role and to be able to do that effectively and have that confidence in that role. So I think that's one of the things that really makes us great. And as Lisa has also said, we're always looking for new ideas on ways to do things better. So we're not that kind of company that says, this is the way we've always done it, because when we hear that, I think it sends chills down all of our backs and we're always looking for something better. So I think, you know, some of the things that we've been able to make some changes on. I'm a new leader to ThedaCare. I just started in November and I've been able to implement a lot of change since I've been on board. So they're always looking for ways to find new ways to do things and do things better. And it's all for the patients, no matter what role you're in.
Thank you, Anissa. And then Tony, would you like to introduce yourself and Senior Care Services? Tony, you're on mute.
Try that again. I'm like, oh, I'm talking to myself here. Sorry about that. Good afternoon, and thank you for the privilege to be able to speak to you and talk about ThedaCare this afternoon. I've actually, I would like to share my story with you, if you don't mind. I have a pretty remarkable story here with ThedaCare, giving me opportunity for growth. So I started at ThedaCare about 23 years ago. I started as a associate's degree administrative person working on the hospital switchboard. It was a great opportunity to learn all about the ThedaCare system. I got to do codes and all kinds of things and learn all about the different providers and services of ThedaCare. And I grew with the system. When I started, there were 2 hospitals. Now we have 7. I went back to school. I did some phone answering at ThedaCare on call and scheduling patients over the years, worked in central scheduling for a while, all along with wonderful leadership who encouraged me to learn and grow. Went back to school and got my bachelor's degree and am now a manager for the last 2 years. So there is so much opportunity and growth here. My team is a group of providers, nurses. When I say providers, it's physicians, it's nurse practitioners, physician assistants. We have scheduling team members. We go out into nursing homes and assisted living facilities all across the ThedaCare footprint. We have 840 patients that we serve today. I've had a great opportunity, and I myself as a leader now feel privileged to be able to do that and help grow the team that I have. So I'll give it back to you, Diane. If you have any questions, please ask.
Thank you, Tony. Yes, and if any of the students do have any questions, I know that there was some time at the end, but feel free to put them in the chat or certainly let us know. Then I'm going to hop over to Chris Wilson, who she will introduce herself.
Hi, I'm Chris Wilson. I'm the manager at the Heritage. The Heritage is home to our residents, both independent and assisted living. At the Heritage means giving each resident the support and encouragement to truly enjoy the things that matter most in their life. They live here, they have an apartment or We have some respite care that we also provide too. We have around the clock care team available for cooking, housekeeping, activities, maintenance, and many other support roles, billing, receptionist. Our team is led by a team of RNs and CNAs, and now patient care tech, which is our new role, which is we are a program that is training people without any experience in caregiving. We put them through a training course here on site, and they're given about 2-week course, and then we let them provide cares just as a CNA does. So a lot of great opportunities for some students that want to experience that hands-on care roles, getting that direct patient contact without needing a license or a certificate, and we can help you work up to that. We also have a lot of dietary aids that are flexible scheduling to work, with school schedules. We have about 147 rooms here at the Heritage. Many are double rooms, so we have about 140 residents right now.
Thank you, Chris. And Kathy Weir, would you like to introduce yourself?
Sure, happy to. My name is Kathy Weir, and I'm the manager over our respiratory services here at ThedaCare. Our services really entail anything from a nebulizer all the way up to a ventilator. And we also, as Lisa had mentioned, we also have 5 retail locations. So some of our services kind of overlap into the retail area, where we see a lot of clientele for sleep apnea services. So I bet all of you know somebody who's on a CPAP. So we have a very, very large program with that. Our staff really consists of both clinical and non-clinical. I always like to say it takes a village to make all this happen. So we have about half of our staff are respiratory therapists. And again, they kind of specialize either in sleep or what we call our home care services. And then the other half is really about our support services, which are so critical to our success as well. From our authorization specialist to our warehouse team, who shares all the equipment, is functional, ready to go, to our purchasing team, our reception team. And it really is just a variety of folks that kind of make it happen. And those folks come to us with not necessarily medical background, but come to us from a really wide area of they may come to us with business degree, or they may come to us with perhaps some CNA background, some insurance background. So really, we look for some ideal individuals that kind of fit more with our culture and our values. I always say hire for the attitude and train for the competence. And so that's really what we look at when we're looking at our core values. I think Lisa kind of summed it up. Everything that you said, Lisa, I had taken notes as far as, what kind of organization we are and what we're committed to. So it must be that we actually live it, because my notes match Lisa's. So I won't bore you with duplicating that there. Cumulatively, we service about 20,000 different unique customers and patients every year. So we have a pretty big outreach. And the last thing that I'll put a plug in for is for, this side of healthcare, because I've been doing this for about 30 years. And I think, where post-acute is where the future of healthcare is going. We're not seeing more and more people in the hospital. We're seeing them trying to be at home, recuperating at home. So don't forget about home care when all of you students are looking for a path, because I think it's pretty exciting and we get to meet patients where they're at. So that's why I stay.
Oh, that's a perfect segue then for Lindsay. So Lindsay, will you introduce yourself, please?
I am Lindsay Abad. I'm the home care clinical manager for ThedaCare at home. Kathy, you kind of stole my thunder. So home is where the patients want to be. They really don't want to be sitting in a hospital. They don't even really want to be in a skilled nursing facility. They want to be home. So the purpose of home care services is really to be able to meet the patient where they're at and teach them how to manage their care so they can be successful at home and stay at home. We have a multidisciplinary team. So we have nursing, PT, OT, speech. We hire PTAs and OTAs. We have social workers and CNAs, and we have a whole slew of the non-clinical staff members that help us keep our operations running. Really, I think what sets ThedaCare at home apart from a lot of other areas is that our opportunity to grow is is extensive. I mean, myself, I went from being, a field RN to a supervisor to now the manager, but we also have, lead opportunities. We have an educator opportunity. We also are looking at certifications for our employees because there's a lot of things our employees can be certified in. So there's just a lot of opportunity to grow. So if that's what you're looking for, if you're looking for a career path and really an organization that's going to support that growth, that's what ThedaCare is. Thank you.
Thank you for sharing that, Lindsay. And then Tracy, would you share your role with us?
Yeah, so my name is Tracy Buds. I'm the Director of Post-Acute Services. So I oversee home health, respiratory, DME, and infusion therapy. So kind of like what Lindsay and Kathy were discussing, there's so much change in healthcare right now and so much opportunity. And ThedaCare is here to offer every pathway or opportunity you can imagine. Right now, we're seeing after COVID, healthcare is really transitioning from brick and mortar to home, and that's where the patient wants to be. So we have an opportunity at ThedaCare to start reaching out to the community, building programs that offer the care in the home, whether it be hospital to home, primary care to home, SNF to home. So really getting to be part of something where we're growing and making a difference in the community has just really been a great opportunity. And you don't need to be clinical. There's different skill sets we're seeing a lot now too with remote monitoring. It can be someone who's IT techie and teaching the person, those are tablets and equipment. So really just so much opportunity in different paths. So thanks for being here.
Thanks, Tracy. And Tina, can you share a little bit about what you do? Tina, you are on mute if you're trying to talk. No, she was having a few issues earlier. Okay, is there anybody else from ThedaCare that I had missed? Okay, Jamie, I guess this would probably be our time for question and answer. So do you have some questions that you have for the ThedaCare employees?
Well, thank you again for sharing all of the different areas within ThedaCare. If students have any questions, if you could type those into the chat so then we can get a response to your question. We'll give a few seconds. Don't be shy. Type one in. I promise I won't read your name. But this will give a great opportunity for the ThedaCare team then to respond. But I would like to kick off with a question as students start to think. So if a student is interested in healthcare and doesn't quite know what to do, what type of experiences would you recommend based off of knowing that the majority of these students are pursuing a bachelor's degree and it may not be in a client-facing program or major?
This is Lisa Nebel. I think the best opportunity would be to volunteer. There's a lot of volunteer opportunities at ThedaCare. Whether it's in, a patient-facing role or a non-patient facing role, I think that would be a good start. I guess in post-acute, we would allow shadowing. If you just wanted to come and spend a few hours, let's say in our DME retail store or, billing or insurance or intake, we would certainly be open to those opportunities. In terms of, there's a question in the chat about summer internships. We are looking to do summer internships. We would be very open to working with UWO specifically in post-acute. and I'm just speaking for myself, but I do see that in some of those non-clinical areas as well. Whether it's data analytics or whether it's quality or whether it's, sales, marketing, finance, we would certainly, look to find a way, because as you all know, we're ready for some employees. So again, think about volunteering, think about contacting, Diane, if, or maybe through Jamie, we'll give you some, contact information. Volunteer, shadow, summer internships. We'd really like to do that. Does any of the other team have any answers to those questions? I'd let you chime in too.
This is Lindsay. From a clinical perspective, I know that home care has accepted students in the UW Accelerated program, where the students have done their community clinicals with us, which has been a great success. And we've also had good success with student externships as well in the past. So from a clinical perspective, that's what I do know.
Senior Care has also had clinical students here for rotations for nurse practitioners, physician assistants, so that's also an opportunity.
So the next question would be, what types of paid internships might you have, and would they be available yet this summer?
I don't. I know that our HR department was working on those internships, and I'll be honest, I would have to reach back out to them to find out what is available. So what I can do, Jamie, is after I connect with them, I will circle back with you so we can get that information sent out.
Excellent. And then I can email it to all of the participants on the call today.
Okay, that sounds great.
All right, any other questions from the students here? So I think there might have been a few acronyms used that students might not quite understand, as we all have our own alphabet soup, no matter what industry we work in. So if you might want to explain durable medical equipment and some of the other acronyms that were used, just because those might not be so clear for the students.
Yeah, I can take that one. DME stands for durable medical equipment, and it really just signifies all of those products that can be used in the home. So we do DME and DMS, which would be more of the supply end. So the durable medical equipment is going to be your walkers, your wheelchairs, your canes, your oxygen equipment, your ventilators, things of that nature.
And I think one of our folks used the acronym SNF, which means skilled nursing facility. Is there anything else, Jamie, that stuck out that you caught that we had spoken about?
No, I think those are the main ones.
Okay. Yes, sometimes we are in our own world and forget that.
So if a student is interested in volunteering, would you recommend that they just go to the main ThedaCare website, or how would they find those volunteer or job shadow opportunities? Or is there a person that we can put in the chat to reach out to?
Well, I believe it's the main ThedaCare website, and then they would guide us. Although there are some other positions, like for example, if anybody ever wanted to volunteer with hospice services, we actually do coordinate that with our volunteer coordinators. So would you recommend that they would just reach out to our coordinators on that, or would they go through the corporate office?
I think right now, for any of the areas that we discussed today, if you wanted to work through our volunteer coordinators, we would definitely make sure that you get in contact with the right individual. We can point you in any direction too. If you start out with one area and you feel like maybe you were looking for something a little different, just make sure you keep us updated with where things are at, and we're happy to make sure that we get you to the right place for that volunteer opportunity.
All right, any other questions?
I think actually we are trying to get one of our folks off of mute, Tina Marchand, who is the manager for Juliet Manor, which is one of our skilled nursing facilities. Do we have success, Tina?
Oh, please tell me you can hear me.
Yes, we can hear you. So we would
okay.
wanted to provide her the opportunity to share with the students as well.
You guys, I have just had the toughest 15 minutes with technology, I'm telling you. So I'm so grateful to talk to you. My name's Tina. I'm the administrator of ThedaCare's rural skilled nursing facility in Berlin. We are small but mighty. We have 37 beds and we feel pretty brand new, so state of the art. We are 24-hour operations and we do long-term care, dementia care, end-of-life care, and a lot of post-acute care. So the really neat thing about anyone coming in is you have exposure to a lot of different types of patients in healthcare, from long-term care to just coming in and going back out. We have a lot of different departments, so we're 24 operations, and we have everything needed to really take care of the holistic needs of our patients around the clock. So we have dietary staff, we have nursing staff, we have therapists, we have a lot of business office and management positions. We have a ton of opportunity for growth, particularly in the patient care departments. So you can come in as a CNA, you can grow through the nursing programs, whether it's LPN, RN. We have a lot of different support positions in nursing, like a lead RN, an admissions nurse, data analysis nurse, director of nursing. We are very, very lucky to interconnect with most of the people that have already talked to you today. So we work very closely with hospice, palliative care. Senior Care Services provides our patients with all of their clinical oversight and care. We hook our patients up with home care when they go home. So ThedaCare becomes a huge family to employees, regardless if you work in the rural communities or in the big hospitals, and that's really neat. I just have the great job of working with a very driven team. And, it's my role to empower them to do their best work, to continue to learn, to grow, to meet all of the more complex needs of our residents that are coming in, to do their best work and just, continue to provide successful outcomes to the people that we take care of. Trying to think what else I had for you. I guess that's it. I'll just, mirror the things that the rest of the group has said. It's just really our operations. They mirror the vision and mission of ThedaCare. We have an amazing system around us. We're lucky to be a location that you can come in and get a very entry-level position or get your first position as a licensed individual and get some great experience and then grow into a much larger organization. So I think that's all I have. And thank you guys so much for the time.
Thank you, Tina. Well said. So I know we're coming up on time here, but one of the questions that was, and I would like to certainly pose this to some of our ThedaCare team, what are some of the things you've learned from having this job or some of the challenges that we faced?
I can say that life in healthcare and ThedaCare is never boring. We are always busy. And one thing you can count on is things will be different and change tomorrow. So if you're looking for, a career to, test your ability of change, come into healthcare. It's very rewarding. We are very busy. You can be very creative. So
I think
it's been great.
Sorry, Lisa. I think another challenge to kind of go off of what Lisa said is just you're constantly challenged with ways to think differently about doing what you are doing on a daily basis in order to innovate and improve on all the processes that you're doing. And so that is a great challenge on a daily basis, but it's also what makes it very exciting.
I can add to that too, coming from a different company to ThedaCare, is that ThedaCare truly lives by its mission, and there are so many different career ladders that they can offer you, and you can really grow with the company. And it's local, so it is all run by your local folks right in the valley and surrounding areas. So it's really nice to have that.
I will just say, if you want the ability to learn and grow, ThedaCare is the right spot for you, regardless of what location you choose, because you will have to adapt and learn and grow. As Lisa said, to keep up with healthcare, it's a different world post-COVID. We all see that. The fun thing is that ThedaCare is filled with knowledge and expertise. And when you're in one setting and you need resources and discussion and assistance from somebody else on the other side of ThedaCare, they're always there. So together we learn, we continue to grow to meet the needs of our patients, and it feels really amazing to be able to do that together.
Thank you.
All right. Well, it doesn't look like we have any additional questions. I'll take this opportunity to see if you have any last tips or advice to share with students as they progress through their academic programs and look towards graduation.
I would say, look at our website. There's plenty of opportunities. Apply online, be diligent, and be prepared. And, please contact, any of us if you're looking to, speak to us about any post-acute careers. I'd be more than happy to speak with any of you. I've been in healthcare a long time and had many different roles, clinical and managerial. So I would just offer that up to, my email, my phone number is available to all of you, and we can I can put that in the chat. So good luck to all of you, and think of us when you're looking for, future employment.
Yes, and I would also just offer that as well, Jamie, because I can certainly be the liaison between all of our services. So if there's any student that has a question, I can help them get those answers and help guide them along the way if they're interested in a position with us.
Well, excellent. I greatly appreciate your time and your insight that you were able to share this afternoon. Everyone would clap and applaud because I'm sure they learned a few bits of information, especially the positions that may not be focused on direct patient care. So again, thank you again for participating, ThedaCare team, we'll say, and we look forward from UW Oshkosh, obviously, to continue the partnership, and I hope more students find great opportunities in the near future with your organization.
Wonderful. Thank you so much.
Thanks, everyone.
Thank you, guys.
Mm-hmm.
Bye.
Bye-bye.